Something else we are watching in less constructive news is what is happening with COVID-19 here in the U.S. Record number of infections, hospitalizations now at a record, and deaths, unfortunately, starting to rise in kind with those two, as many healthcare experts warned citizens over the last month or so. Anjalee Khemlani joins us now for the latest on that. And Anjalee, Monday, obviously a very constructive day for investors. I think it's a constructive day for everyone who wants the pandemic to be over. There's no doubting that. But the facts on the ground right now and what the data are telling us about the next couple months in the US, in Europe right now are quite troubling, perhaps the most troubling they've been since the beginning of the pandemic.
That's right. So unfortunately, we're seeing those numbers rise. We're seeing those restrictions in Europe and some being weighed here in the U.S. We know that in some states there have been reductions of hours, curfews implemented, et cetera, to go in hand with the rises that we're seeing in hopes that people will, in fact, revert to some of the social distancing and other practices that were implemented at the start of the pandemic. And all of this really in line to wait for the vaccine, to wait for treatments. We know we heard some really positive news on that this week, especially when coming from Pfizer with their 90% efficacy data, but really waiting to hear more about that likely in the coming weeks. But meanwhile, overseas, that's something that has been paid less attention to and really is important when it comes to this sort of global vaccine race. We know that nationalism is playing a huge role in the efforts, and that includes Russia and China. So today, Russia out with, just after Pfizer saying it's 90% effectiveness, Russia saying that theirs is at 92, but also some conflicting reports saying that some of those who did receive the vaccine did end up getting sick. And this, of course, is a vaccine, Sputnik 5, that we know is the Russian vaccine that is already being used, has been approved to be used, despite the fact that trials are ongoing, and really seeing sort of this push from countries like Russia and China into the global space, where trials are taking place in other countries as well. Just this week as well, China reporting that its vaccine from Sinovac resulted in some adverse event in Brazil. And so that trial was paused in Brazil, though authorities have said that the adverse event is unrelated to the vaccine. And of course, we remember that adverse events have happened even with AstraZeneca and Johnson & Johnson, and those trials were paused for quite some time. So waiting to see how this all pans out. But as it stands, it opens the door, especially with nationalism at play and sort of countries, richer countries, Western countries, looking at keeping the vaccine a priority to themselves. Some of the middle and lower income countries are probably going to be looking at countries like Russia and China for vaccines. So very concerning, with some health officials saying that the data is not yet known on a lot of this, and it really remains to be seen just how effective they can be, considering the standards that they're following are different from what we're used to here.